Stroke in the elderly. The silent warning that Pope Francis's case revealed to the world. Have you ever wondered why so many seniors are affected by stroke without any warning? Are your loved ones at risk right now without you realizing it? What if there were subtle signs that could save the life of someone you love? Cerebrovascular accident, popularly known as stroke, is a condition that affects millions of elderly people around the world annually. When it comes to brain health in old age, many of us ignore the signs until it's too late. The statistics are alarming. Every 40 seconds, someone suffers a stroke somewhere on the planet. Why do we continue to treat this condition as something far from our reality? The recent case involving Pope Francis has brought to light a crucial discussion about the vulnerability of older people to this devastating condition. What makes this case so important is that even with access to the best medical care in the world, the religious leader still faced significant risks. If this can happen to someone constantly monitored by experts, what about ordinary people? Knowledge about prevention and early identification can literally be the difference between life and death. Are you prepared to recognize the signs before it's too late? Let's get started. The truth revealed. What no one tells you about stroke is much more than just a stroke, as many know it. It is a sudden interruption of blood flow to a region of the brain. This interruption can occur in two main ways: by obstruction of an artery, ischemic stroke, or by the rupture of a blood vessel, hemorrhagic stroke. Both types cause brain cells to die in a matter of minutes. Every minute during a stroke means the loss of approximately 2 million neurons. It's as if a fire is occurring inside the brain, and the longer it takes to put it out, the greater the damage. Many people mistakenly believe that stroke is an exclusive condition of the elderly, but the truth is quite different. While age is a significant risk factor, with the risk doubling every decade after the age of 55, other factors also contribute enormously. Recent research by the World Health Organization indicates that 80% of cases could be prevented with lifestyle changes. The silence that precedes stroke is precisely what makes it so dangerous for our elderly. Unlike other conditions that have clear warning signs, stroke often does not give prior warning. It is as if the body could not scream for help before the disaster happened. Perhaps the scariest thing about this condition is its ability to transform lives in a matter of seconds. A person can be perfectly fine one moment and completely incapacitated the next. That's why understanding the mechanisms of stroke and its risk factors is critical to protecting those we love. You may be wondering why we talk so much about seniors when we mention stroke. The answer lies in the natural changes that occur in our bodies with aging. Over the years, our arteries naturally lose elasticity and become stiffer. This condition, known as arteriosclerosis, facilitates the accumulation of fatty plaques on the walls of the arteries. When we think of seniors like Pope Francis, we need to consider the additional burden that decades of stress and demanding commitments place on the cardiovascular system. What his case teaches us is that even with constant monitoring, the risk remains. And now, are you ready to meet the real enemy that lurks in the shadows? The silent enemy. Discovering the hidden causes of stroke in the elderly. When we deeply investigate the causes of stroke in the elderly, we find a complex scenario of interconnected factors. Advanced age brings with it a series of physiological changes that significantly increase the risk. Blood vessels become less flexible and more prone to damage as the years go by. The heart, which has pumped blood tirelessly for decades, can develop arrhythmias such as atrial fibrillation. This heart condition accounts for approximately 20% of ischemic strokes in the elderly. When the heart doesn't beat in a regular rhythm, small clots can form and travel to the brain. High blood pressure, known as the silent killer, is perhaps the most significant risk factor for stroke. After the age of 65, more than 60% of the elderly live with high blood pressure that is not adequately controlled. Every 20-point increase in systolic pressure doubles the risk of suffering a stroke. The real danger lies in the fact that many elderly people live with hypertension for years without knowing it. Diabetes is another factor that dramatically increases the risk by silently damaging the small blood vessels. A diabetic elderly person is 2 to 4 times more likely to suffer a stroke compared to a non-diabetic person. High cholesterol contributes to the formation of plaque in the arteries, narrowing the passages through which the blood circulates. These plaques can rupture at any time, forming clots that completely block cerebral blood flow. Genetic factors also play a crucial role that is often underestimated in medical evaluations. A family history of stroke or cardiovascular disease can increase the risk by up to 3 times. Elderly women deserve special attention in this context, because after menopause they lose hormonal protection. This explains why, after the age of 85, women have higher rates of stroke than men. The sedentary lifestyle, so common in old age, accelerates all these processes that are harmful to the brain. Lack of regular physical activity contributes to obesity, another significant risk factor for cerebrovascular events. Chronic stress, often overlooked in medical evaluations, causes systemic inflammation that is harmful to blood vessels. These silent factors work together, like a perfect storm, exponentially increasing the risk over the years. Have you ever stopped to think about how to identify a stroke before it causes irreversible damage? 5 warning signs that can save the lives of those you love. 1. The face that betrays. When facial weakness signals imminent danger. The first and perhaps most recognizable sign of an ongoing stroke is sudden facial asymmetry. Watch closely when the person smiles or tries to make normal facial expressions. If one side of the face appears droopy or does not move in the same way as the other, this is extremely concerning. This sign occurs because stroke affects the nerves responsible for controlling facial muscles. The person may not notice this change, but for outsiders the difference is usually noticeable. Ask the person to smile or show their teeth as if they were grimacing. The difference between a small normal asymmetry and the sign of stroke lies in the sudden appearance of the symptom. If this facial change has appeared suddenly, do not hesitate to seek medical help immediately. This sign can be subtle in some cases, especially in elderly people who already have wrinkles or facial sagging. Remember that time is crucial, and even a small suspicion warrants an emergency medical evaluation. It does not allow the person to try to rest to get better when this sign is present. Facial paralysis does not cause pain, which can cause the elderly person not to give due importance to the symptom. And do you know what makes this sign even more treacherous for our elderly? 2. When words fail, the dramatic warning that few recognize. Sudden difficulty speaking or understanding what others say is an alarming sign of stroke. This symptom can manifest as slurred, confused, or completely incomprehensible speech. The person may appear intoxicated or confused without having consumed alcohol or other substances. In some cases, the person can form clear thoughts, but cannot express them verbally. In others, she can speak fluently, but the content doesn't make any sense to the listener. The visible frustration in the eyes of someone trying to communicate without success is one of the most devastating signs of stroke. This sign happens because stroke affects areas of the brain responsible for language and communication. A simple question like, "Repeat a simple phrase," can help identify this sign. Phrases such as, "The sky is blue," or "Today is Sunday," can become impossible to repeat during a stroke. Do not confuse this symptom with the mental confusion common in dementia or old age. The crucial difference lies in the sudden onset of this problem, not in a gradual deterioration. Older people with hearing problems may not seem to understand what is said, but this is different from a stroke. Some people experience so-called aphasia, completely losing the ability to form words. Are you ready to recognize the next sign that many mistake for common age problems? 3. Windows of the soul in danger. Vision changes you can't ignore. Sudden visual changes are signs that are often ignored, but extremely important in identifying a stroke. The person may report blurry, double vision, or even loss of vision in one eye. Some describe it as a curtain that suddenly covers part of the visual field. This symptom occurs because stroke affects brain areas responsible for visual processing. The human brain devotes nearly a third of its capacity to visual processing, making these symptoms particularly revealing. The elderly person may bump into objects, not be able to read normally, or not recognize familiar faces. Often the person does not realize that they are seeing only half of the visual field of each eye. This phenomenon, called hemianopia, is often confused with common eye problems. To test, ask the person to describe what they see in different parts of their field of vision. Don't believe it when an elderly person says that their vision is only tired if the problem suddenly appeared. Unfortunately, many confuse these signs with simple eye strain or the need to change glasses. This confusion causes fatal delays in seeking proper medical care. Remember that visual changes caused by stroke do not improve with rest or eye drops. Could you identify when a simple dizziness can mean something much more serious? 4. The ground that moves. When dizziness reveals a ticking time bomb. Sudden dizziness or unexplained loss of balance can be a crucial sign of stroke, especially in the elderly. This symptom occurs because stroke can affect the cerebellum, the area responsible for coordination and balance. The person may stagger as if intoxicated or be unable to walk in a straight line. Some report a feeling that the world is turning or that they are about to faint. Many elderly people already live with occasional dizziness due to problems such as labyrinthitis or the effects of medications. The life-saving difference is in the intensity and abrupt onset of this symptom during a stroke. The sudden inability to stand without support should not be ignored or attributed simply to age. A simple check might be to ask the person to extend their arms in front of them with their eyes closed. During a stroke, one of the arms may deviate or fall off involuntarily due to neurological impairment. Another simple test is to ask the person to walk a few steps in a straight line, if it is safe to do so. Disproportionate or sudden difficulty in performing this simple task may indicate a cerebrovascular event. Don't ignore when an elderly person who has always been stable starts knocking over objects or bumping into things. Impaired motor coordination can be one of the first subtle signs of an ongoing stroke. And now, are you prepared to meet the latest and perhaps most dramatically ignored sign? 5. The pain that cries out for help. Overwhelming headache as a last warning. A sudden severe headache, often described as the worst of my life, can signal a hemorrhagic stroke. This particular type of pain occurs due to bleeding in or around the brain. Unlike common headaches, this one sets in quickly and reaches maximum intensity in seconds. The pain may be accompanied by nausea, vomiting, and extreme sensitivity to light or sounds. Many elderly people who suffer this type of stroke describe an explosion sensation inside the head. The real danger is when this devastating pain is mistaken for a simple migraine or tension headache. In the case of elderly people with a history of migraine, the difference is in the unusual pattern and unprecedented intensity. Any headache that awakens the elderly during sleep deserves immediate medical attention. If the pain begins during some physical exertion, even a mild one, the risk of hemorrhagic stroke is even greater. Do not allow the elderly to take painkillers and wait for the pain to pass without proper medical evaluation. This is an emergency that requires specialized care immediately, not in a few hours. Remember that this type of stroke has a high mortality rate if not treated in the first few hours. Combining this pain with any of the other signs mentioned earlier dramatically increases urgency. Now that you know the signs, we need to understand what really puts our seniors at risk. The real triggers, risk factors, that few doctors discuss. In addition to traditional factors like hypertension and diabetes, there are lesser discussed triggers that increase the risk of stroke. Social isolation, so common among the elderly, increases the risk of stroke by up to 64%. Elderly people who live alone are less likely to receive immediate help when the first symptoms appear. Depression in old age, often undiagnosed, increases the risk by about 30%. Chronic stress elevates cortisol levels, causing systemic inflammation and increasing blood pressure. Doctors' silence on sleep apnea leaves thousands of seniors at unnecessary risk of stroke. This condition, which affects up to 70% of the elderly, practically triples the chances of suffering a stroke. During apnea episodes, oxygen in the blood drops dramatically, stressing the cardiovascular system. Another factor rarely discussed is the impact of sudden climate change on the risk of cerebrovascular events. Sudden drops in temperature increase stroke hospitalizations in the elderly by up to 14%. Dehydration, which is extremely common in old age, increases blood viscosity and the risk of clots. Many elderly people reduce their fluid intake to avoid frequent trips to the bathroom without realizing the danger. Certain commonly used medications, such as non-steroidal anti-inflammatory drugs, can increase cardiovascular risk. Long-term use of anticoagulants without adequate monitoring can both prevent and cause strokes. The combination of medications prescribed by different specialists often creates dangerous interactions. Nutritional deficiencies, especially of vitamin D and B12, are strongly associated with increased risk. Recurrent or chronic infections keep the body in a constant inflammatory state, damaging blood vessels. Knowing how to identify these factors can make all the difference in preventing a family tragedy. But what happens when we suspect a stroke? How to quickly confirm the diagnosis? Against the clock. How immediate diagnosis turns victims into survivors. Time is the most critical factor when we talk about the diagnosis and treatment of stroke in the elderly. The medical expression, "time is brain," has never been more true than in these cases of neurological emergency. For every minute without treatment, approximately 2 million neurons die irreversibly. Rapid diagnosis begins even before arrival at the hospital, with the identification of signs by FAST. FAST is an acronym that stands for face, arms, speech, and time. The difference between complete recovery and permanent sequelae is often in the first 90 minutes after symptoms. Upon arrival at the emergency room, the elderly person should immediately inform that he suspects a stroke. This simple communication can reduce the waiting time for crucial exams such as CT scans. CT scans can differentiate between ischemic and hemorrhagic stroke in a few minutes. This distinction is fundamental, as the treatments are completely different for each type. Blood tests help rule out other conditions that can simulate a stroke, such as hypoglycemia. New technologies such as perfused magnetic resonance imaging allow the visualization of areas of brain tissue that are still viable. The concept of ischemic penumbra has revolutionized treatment, identifying cells that can still be saved. In specialized centers, multidisciplinary teams are on standby 24 hours a day to attend to stroke cases. These teams include neurologists, radiologists, specialist nurses, and imaging technicians. How quickly this team takes action can determine whether the senior will return to talking, walking, or being independent. Hospitals certified as stroke centers follow strict protocols that drastically reduce the time of care. And once the diagnosis is confirmed, what are the life-saving treatment options? Arsenal of Hope. The innovative treatments that are changing stories. Stroke treatment has evolved dramatically over the past few decades, offering new hope for recovery. Thrombolytic therapy, using clot-dissolving drugs, can completely reverse symptoms in eligible cases. The drug RTPA, recombinant tissue plasminogen activator, should be administered within 4.5 hours of the first symptoms. For a few carefully selected patients, this window can extend up to 9 hours. The most impactful revolution in recent years has been the development of mechanical thrombectomy techniques. This minimally invasive procedure allows you to physically fish the clot from the cerebral arteries. Special catheters are introduced through the groin and navigate to the brain guided by images in real time. Thrombectomy can be performed within 24 hours of symptom onset in selected cases. For hemorrhagic strokes, medications to control blood pressure are given immediately. In some cases, emergency surgeries are required to drain the bleeding and reduce intracranial pressure. Advances in neuroprotection are under development to protect brain cells during the event. Hyperbaric oxygen therapies show promising results for recovery of affected areas. Deep brain stimulation emerges as an innovative technique to reactivate damaged neurological circuits. Stem cells are being studied to potentially regenerate brain tissue after extensive damage. Each of these treatments has a greater chance of success the sooner it is started. That's why recognizing the signs and seeking help immediately makes all the difference. But how can we prevent stroke from happening in the first place? Is prevention possible? Protective shield. Proven strategies to shield your brain. Stroke prevention in the elderly involves multiple strategies that, when combined, dramatically reduce the risk. Strict blood pressure control is probably the most important preventive measure of all. Keeping the pressure below 140/90 mmHg can reduce the risk of stroke by up to 40%. Antihypertensive medications should be taken regularly, even when the person feels well. Home blood pressure monitoring allows early detection of worrisome changes. The Mediterranean diet. Rich in olive oil, fish, and vegetables, reduces the risk of cerebrovascular events by 30%. Regular physical activity, even if moderate, decreases the risk by up to 25%. 30 minutes of walking 5 times a week can make a significant difference in cerebrovascular health. Tight control of diabetes by keeping glycated hemoglobin below 7% protects blood vessels. Quitting smoking reduces the risk by half after just 1 year of not smoking. Moderate alcohol consumption, no more than 1 daily drink, may have a protective effect, but excess significantly increases the risk. Keeping LDL cholesterol below 100 mg/dl is essential to prevent the formation of plaque in the arteries. Adequate water intake, at least 2 liters daily, helps maintain proper blood viscosity. Controlled sodium consumption, less than 2 grams per day, helps control blood pressure. Managing stress through techniques such as meditation and yoga demonstrates significant benefits for the cardiovascular system. Treating sleep apnea with CPAP devices dramatically reduces the risk of nocturnal cerebrovascular events. Regular medical appointments for medication adjustment and early detection of problems are essential. Periodic examinations such as carotid Doppler can identify arterial narrowings before they cause problems. The annual electrocardiogram helps detect cardiac arrhythmias that increase the risk of clot formation. And for those who have already suffered a stroke, what does the path back to independence look like? Neurological rebirth, the surprising path to recovery. Rehabilitation after a stroke is a challenging journey, but recent advances offer new possibilities. The human brain has a surprising capacity for adaptation known as neuroplasticity. This ability allows healthy areas of the brain to take over functions from the regions damaged by stroke. The rehabilitation process should begin as early as possible, ideally within the first 48 hours. The intensity and frequency of therapy in the first 3 months after stroke determine much of the final outcome. Multidisciplinary teams including physiotherapists, speech therapists, and occupational therapists work together. Each specialist addresses a different aspect of the sequelae, from mobility to speech and swallowing. Technologies such as virtual reality are revolutionizing physical therapy, making it more engaging and effective. Robotic exoskeletons allow patients to walk again, even with severe motor impairment. Transcranial magnetic stimulation stimulates specific areas of the brain to speed up recovery. Specialized software helps in language recovery, even in cases of severe aphasia. Psychological support is essential for both the patient and family members during this process. Post-stroke depression affects up to 50% of survivors and can significantly slow recovery. Proper family support can improve rehabilitation outcomes by up to 40%. Adaptations in the home environment allow for greater independence and reduce the risk of falls and complications. Setting realistic and progressive goals maintains motivation during the long recovery process. And what can we learn from one of the most newsworthy cases of 2023? Lessons from the Vatican. What Pope Francis's case teaches the world. The case of Pope Francis has highlighted important lessons about stroke in the elderly that we cannot ignore. Even with access to the best medical resources in the world, the leader of the Catholic Church faced significant risks. The pontiff's advanced age, 86 years old in 2023, automatically places him in the highest risk group. The extremely busy and stressful schedule demonstrates how lifestyle can increase cerebrovascular vulnerability. The Pope's example shows us that no one is immune to silent threats that compromise brain health. The transparency with which the Vatican handled the pontiff's health episodes helped raise global awareness. Millions of people started to seek information about warning signs and prevention of stroke after the news. The rapid medical intervention in the Pope's case exemplifies the importance of early diagnosis and treatment. The pontiff's ability to resume his activities demonstrates the power of adequate and personalized rehabilitation. Her determination to stay active even after health problems inspires seniors around the world. The balance between responsibilities and self-care is a valuable lesson for everyone, regardless of age. This emblematic case serves as a powerful reminder. We must be attentive to our body's signals. Brain health needs to be a priority, not just a secondary concern in our busy lives. Which brings us to the ultimate question. Are we prepared to protect those we love? The power is in your hands. Turning knowledge into action. Now that you know the signs and risk factors of stroke, this knowledge brings with it a responsibility. You can literally save someone's life just by being on the lookout for the subtle warning signs. Share this information with family, friends, and caregivers of seniors in your community. A simple conversation at Sunday lunch can be the difference between life and death in a future emergency. Encourage seniors around you to keep regular doctor's appointments, even when they feel well. Prevention is always the best way, but being prepared for emergencies is equally essential. Program emergency numbers on seniors' phones for quick access in critical situations. Consider technologies such as medical alert devices for seniors living alone. Organize a support network with regular checkups for elderly people in vulnerable situations. Attend basic first aid training to learn how to act in emergency situations. Promote healthy habits not only with words, but with daily examples in your own life. Remember that brain care does not begin in old age, but in every choice we make throughout life. With every balanced meal, every walk, every moment of relaxation, we are investing in our future brain health. Stroke can be devastating, but with knowledge, prevention, and quick action, we can drastically change this scenario. The power to turn alarming statistics into stories of hope is literally in your hands. Every minute counts. Every recognized sign is a chance to rewrite someone's destiny. Don't wait for tragedy to knock on your door to learn the importance of vigilance and prevention. The knowledge you gain today may be exactly what will save the life of someone you love tomorrow. We are all in this together in this mission to protect our seniors and ensure that they enjoy their golden years in health and dignity. Stroke does not have to be a sentence, but an opportunity to value even more each precious moment with those we love.